Well, hello, everybody. Again, we've got a great guest today. So it's Garren Colvin, CEO of St. Elizabeth Healthcare. Garren, thanks for, again, giving us some of your time.
Oh, thank you, Kris. Thank you for your leadership, and thank you for the opportunity to share a little bit of what I know with this community.
You bet. Well, now we're sitting here at the end of August. Things changed in this world of COVID daily, surely daily, if not weekly, for sure. Maybe you can give us an update on in terms of how many people are admitted to St. E's and capacity and kind of where you see things today, how you feel about things as we sit here in end of August.
Super. So, Kris, at the end of August, we're probably in what some have called the second wave of positive in our community. And I think that, from a healthcare system, we're doing great. We still have fluctuated in the last couple of weeks between 35 and 40 positive patients. 4 or 5 weeks ago, we were in the 20s. We've been as high as 45 on this second go around. So as this community has seen an increase in positive testing, we've seen a little bit of an increase in our patient volume. The great news is that the patients that we're seeing are healthier and stand less time, so the length of stay is shorter, but they still need hospitalization. And recently, what we're starting to see is a decrease in our positive tests. So we're anticipating a decrease in the number of positives in patients in our facility.
And are you still focusing on keeping those patients at the Fort Thomas facility or is it spread out?
Correct. All of our inpatients are at the Fort Thomas campus, and we still consider that our COVID hospital. We've done a great job of separating the COVID from the non-COVID throughout our system, and even throughout Fort Thomas. So no spread of the disease inside the walls of our hospital since we went full-time masking long before the CDC required full-time masking.
And you've spoken before about the demographics of those who are admitted in this now shortening period, about the age getting younger. Maybe you could speak to the issue of that you're seeing now with this population.
Yeah, absolutely. So what we're seeing is about a 15-year average decrease in the age of people who are becoming positive. And the result, we're seeing younger people inside the halls for inpatient hospitalization. We've ranged, as low as 22 years old, again, up to 102 years old. So the range is significant, but we are starting to see a younger population, but a healthier population. So still sick, but not as many comorbidities. So the length of stay is not as long. And the mortality's not there as well. So that's all great news.
And I guess part of that has to do with, as we're all sitting here now, school's been reopening, we're sending kids back to college. Some of it, obviously not kids going into schools necessarily right now, but that's going to add to the potential of people needing to be admitted.
So what I would hope, and what we know is the case, the schools are reopening with masking. So if we continue the masking and 6 foot socially distanced, then we're not really anticipating a significant increase or a significant spike resulting from schools opening back up and becoming a little more of an open society and open community. We do think, believe it or not, that most of the spread, one of the main reasons for the spread was just the vacationings and people traveling, having parties again. And so I think a lot of that has died down. So you're seeing less positives. I think even yesterday at the state level, we went below 5% for our positive testing rate. And Northern Kentucky has always been in the 4% range. So we've all been below that 5% threshold, which is outstanding.
Well, and you referred to the fact when you started masking at the hospital well before it was mandated and the results of that. Maybe you can speak to your opinion about what we are doing now moving forward, and maybe even some of the nuances of masking when we're trying to, get back to supporting local businesses, restaurants, things like that. What's your thoughts there, and how do we make sure we keep everything open?
So for me, if everyone in the community would mask, at all times except when they're in their home, I think we could stop the spread of this as quick as a vaccine almost. And in fact, if you stay 6 foot apart and mask, that is equivalent to the stay at home when no one would leave their homes, 4 or 5 months ago. So yeah, we're big fans of masking. And we kind of ran into it by just noticing our infection rate went way down once we required everyone to mask, and that's all infections. So I do think that masking in hospitals is probably here to stay based on the results that we're getting from the masking across the country.
With the goal of keeping everybody from spreading the stuff when you get into the potentially a hospital where everyone is sick sometimes. That's a great takeaway.
Absolutely.
Well, speak to testing as we wrap up. Lots and lots of testing now. Maybe you could speak to where we are, the infection rate you talked about being now below 4% or has been for some time. Where are we there, and what does that look like in your eyes?
So, there's two factors that are really the leading indicators on how prevalent is the disease in your community. If you can have an R factor, which basically, long story short, the R factor just tells you how quickly is the disease multiplying person to person. And if you can get an R factor below 1, and you can get a positivity test rate below 5%, then you will be able to control the spread of the disease in your community. I haven't seen Kenton County or Northern Kentucky's number recently, but we're approaching 1.1 in the recent past, and we know we're below the 5% on the positivity rate. So I think this masking has done a remarkable job. The testing, we've gone over, we're probably approaching 55,000 tests at St. Elizabeth Healthcare alone. So we've stepped up quite a bit to help understand this disease. Our health department has been top notch. They've been on top of this issue, and we've partnered with them on a lot of fronts. And just a shout out to all of our senior living facilities in our community. They are doing a bang up job, and we are having this positivity rate, a positive positivity rate, if that makes sense.
Sure.
Because of the work of this community and all of the facilities in the community. So we're excited about that news. It's not over. The fall is going to maybe be another spike. I think we're on the trend down, but when flu season hits, we're probably going to see a little bit of a spike. But if we continue to mask, socially distance, do everything that we've been told is the best course of action, then I'm excited about getting a vaccine here in late fall, maybe first of the year, and really doing some good with respect to getting back to a new normal.
Well, one of our commissioners just yesterday asked the question, which I think was very good about, and I think you alluded to it. Maybe we wrap up with this one: is when it is testing, as we move forward between now and the time of vaccines. Maybe the idea that it might be better that we are getting more shifted to if you're symptomatic, be tested, as opposed to just kind of whenever you want. Maybe you can speak to that a bit. And there's obviously all these different tests are coming online. Some of them needed, some of them not as needed. But kind of give us your view of that today and and whether or not we should be symptomatic in terms of getting tested.
So, I think one of the things that's important is to recognize that our state has really stepped up to help with the testing.
Yes.
And our counties and cities have stepped up. So we had the ability to do testing when a lot of places across the country pale in comparison to what we've been able to do in this market. The testing is important because when you go to a physician office, typically you're symptomatic. So anybody who is symptomatic will absolutely get a test throughout the St. Elizabeth system, either through St. Elizabeth physicians, through our emergency rooms, through our urgent cares. But what I'm going to say is the walk-up or the drive-through testing that's state-sponsored. That's what's unique to our area that other states don't have. And eventually that's going to go away because right now, if you want a test, you can get a test through appointment at those facilities. Eventually, we'll get back to where it's like traditional flu. The only people getting tested are the people who are symptomatic. And I think the technology is coming that eventually we'll have instant testing in our physician offices so that you're able to test for COVID just like the traditional flu. And when we get to that point, it'd be a great day. The technology exists. The government at the federal level is just trying to eat up that supply to get it to the areas that are really struggling a lot more than Kentucky or Northern Kentucky.
That's a great point. I think, I guess, as we wrap up, the idea being things are evolving daily. You're reacting to that with your teams to make sure, and partnering with the state to make sure that you're testing, you're having availability of care, and then you're evaluating that on an almost daily basis to see what's really necessary to keep these numbers low and keep everybody healthy. I don't know if that's a fair statement, but that's what I'm watching.
Yeah, absolutely. Absolutely fair. I think the thing to keep in mind is we have capacity in Northern Kentucky. We're not concerned with the numbers where they sit today. We have very few people on a ventilator. We have ventilator capacity. We have ICU capacity. So really, what we're really trying to do is stop the spread in the community. And that's the most important thing that we can do as a community.
Well, Garren, I really appreciate, and your entire team, everybody across the board, and comments I've heard about the way the hospital is treated, all your team members, I think, sets a model for probably the country, and really appreciate your all's leadership. Anything else you'd like to make sure that people know about what's going on with St. Elizabeth's efforts in this pandemic timeframe?
I know, just if you see someone that you know works at St. Elizabeth or any healthcare provider in this community, just thank them for what they're doing. They're really going above and beyond. This issue is affecting people mentally, so I think that's the future. We really have to understand the impact mentally, and so that's going to be the top priority moving forward.
Well said. Thank you, sir, and we'll be back in touch soon, and hopefully get another update. Thanks, sir.
Thank you.